In the next few minutes, 10 quiet changes will be separated from ordinary aging, and one may appear on a routine blood sugar report before anyone suspects the pancreas. Stop what you are doing. This information could change how quickly a serious warning is recognized, because early action can alter the path that follows. For some viewers, recognizing that pattern could become a turning point. Current SEER data show a 5-year relative survival rate of about 43.6% when pancreatic cancer is found while still localized. After it has spread to distant parts of the body, that figure falls to about 3.4%. The difference is not small. It is the distance between early investigation and dangerous delay. Dr. Evelyne Emma presents this subject as a senior health medical advisor, explaining patterns older adults often dismiss because they resemble familiar problems. The purpose is not to frighten anyone or turn one symptom into a diagnosis. It is to show when several changes deserve medical assessment instead of another month of waiting. Many seniors know the routine. Energy feels lower, meals feel heavier, the back complains more often, and sleep no longer restores the body as it once did. Each change receives a harmless name: age, stress, indigestion, a bad night. But the body rarely sends its most important messages in dramatic language. Pancreatic cancer is difficult to recognize early because the pancreas sits deep behind the stomach, beyond an ordinary physical examination. Early symptoms may be vague, and many have more common causes. That is why the pattern matters more than any single complaint. One sign may mean little. Several changing together can mean much more. The final symptom in this countdown is easy to overlook because it may first appear during a routine check for diabetes. It may not cause sharp pain or change the skin. It may simply appear as a number moving in the wrong direction. Stay to the end, because that connection surprises many families. The story begins with Grace, a 69-year-old woman who considered herself strong. She managed her home, visited her grandchildren, and rarely complained. Then small changes began to gather. She rested after simple chores. She left food on her plate. A dull discomfort appeared after meals. Nothing seemed urgent when each detail stood alone. The 10th warning sign is persistent fatigue or weakness that feels different from normal tiredness. Ordinary tiredness usually has a clear reason and improves after rest. This kind does not. 8 hours of sleep may pass, yet the body still feels heavy. A short walk may require a pause. Familiar tasks begin to feel strangely expensive. This does not mean fatigue equals pancreatic cancer. Anemia, thyroid problems, infections, medications, poor sleep, and many other conditions can produce the same feeling. Concern rises when the weakness is new, lasts for weeks, grows worse, or appears beside appetite loss, unexplained weight change, abdominal discomfort, jaundice, or unusual stool changes. Hi viewers, are you watching this for yourself or for someone you love? Write myself or family in the comments. That simple answer matters because people who refuse to accept unexplained decline are more likely to notice a pattern early and speak clearly when something no longer feels normal. Grace first blamed her exhaustion on age. Then she noticed the 9th warning sign: repeated nausea, vomiting, or discomfort after meals. A rich dinner was no longer required to trigger it. Even a modest plate could leave her unsettled. She began avoiding food, believing her stomach had become sensitive, while the pattern quietly became more consistent. A growth near the pancreas can sometimes affect nearby digestive structures, interfere with digestion, or place pressure around the stomach and small intestine. That may lead to nausea, fullness, discomfort, or vomiting. Yet these symptoms also occur with ulcers, gallbladder disease, medication reactions, and reflux, so the safest response is investigation, not assumption. The practical step is simple. The person should record what was eaten, when the discomfort began, whether vomiting occurred, and whether pain traveled toward the back. Grace did not yet understand why those details mattered. She only knew every meal was becoming a message. The next warning would make that message impossible to ignore. Grace's next warning appeared at the dinner table. She would sit down hungry, take 3 or 4 bites, and suddenly feel finished. At first, the change seemed harmless. Many older adults eat less. Many blame slower digestion, medication, or stress. But Grace's appetite had not simply softened. It had changed. Meals that once felt normal now felt strangely heavy, and the sensation arrived too quickly to ignore. This was symptom number 8, loss of appetite, or feeling full after very little food. A growth near the pancreas can sometimes press against nearby digestive structures or disturb the normal movement of food. The result may be early fullness, nausea, discomfort, or a growing reluctance to eat. None of these signs proves cancer. Ulcers, gallbladder problems, reflux, medications, and many other conditions can cause the same symptoms. The concern begins when the change is new, persistent, and joined by other warning signs. Grace responded the way many seniors do. She made smaller plates, then smaller ones. She told her daughter that her appetite was simply not what it used to be, but the body was not asking for smaller portions. It was asking to be noticed. There was another detail. The fullness did not end when the meal ended. It lingered. Hours later, Grace still felt as though food had not moved. She began avoiding foods she once enjoyed because eating seemed to come with a price. That pattern mattered. A single uncomfortable meal can be ordinary. A repeating change that quietly reshapes someone's behavior deserves attention. The practical response is simple. The person should write down when the fullness begins, how much food can be eaten, whether nausea follows, and whether there is pain in the upper abdomen or back. Specific details give a clinician something solid to investigate. Vague discomfort is easy to dismiss. A pattern is harder to overlook. Then the scale moved. Symptom number 7 is unexplained weight loss. It often arrives disguised as good news. Clothes loosen, a belt moves to a tighter notch. Friends offer compliments. But weight loss that appears without a deliberate change in food or activity is not automatically a victory. It can be a warning that the body is eating less, absorbing less, or using energy differently because something is wrong. Pancreatic disease can interfere with digestion, especially the digestion of fat. Reduced appetite may lower calorie intake. Nausea may shorten meals. Poor absorption may mean that even the food being eaten is not fully supporting the body. The result can be a steady loss of weight accompanied by weakness rather than renewed energy. Grace's family noticed the change before she did. Her favorite dress hung differently. Her face looked thinner. Yet she had not started walking more, changed her diet, or tried to lose weight. The number on the scale was falling, but her strength was falling with it. That is the distinction. Healthy, intentional weight loss usually follows a clear plan. Unexplained weight loss arrives without permission. It becomes more concerning when it develops over weeks or months and appears beside appetite loss, altered stool, jaundice, fatigue, or persistent abdominal pain. The important question is not only how much weight has been lost, it is why the body is changing without a clear reason. At this point, the viewer has already received information that many families learn too late. If even one of these patterns has changed the meaning of a symptom, this is the moment to press like and subscribe. That small action helps this message reach another older adult who may still be calling a serious change just aging. But Grace's next symptom was the one she had explained away for the longest. Symptom number 6 is pain in the upper abdomen that may spread toward the back. It may begin beneath the breastbone or slightly to one side. It may feel dull rather than sharp. It may come after meals, worsen when lying flat, or seem to wrap through the middle of the body. Because many seniors already live with back pain, arthritis, or indigestion, the warning can hide in plain sight. A tumor in or near the pancreas may press on nearby organs, tissues, or nerves. That pressure can produce pain in the abdomen, the back, or both. Yet this symptom has many more common causes, including muscle strain, spinal problems, ulcers, gallstones, and pancreatitis. The purpose is not to label the pain, it is to describe it accurately. Grace had treated hers with rest and a heating pad. The relief never lasted. The pain returned after meals, then eased when she leaned forward in her chair. She never thought to mention the abdominal discomfort because she believed the problem lived in her back. That missing detail delayed the full picture. A clinician needs the location, timing, triggers, duration, and direction of the pain. Does it begin high in the abdomen? Does it move into the back? Does food make it worse? Has it changed over time? Those answers matter because they separate a familiar ache from a new pattern. And now, the story changes color. The next 3 warnings do not hide in pain. They appear in the urine, in the stool, and finally, in the eyes. Once those signs begin appearing together, the body is no longer whispering. Grace was approaching that moment, unaware that one bathroom visit would connect every earlier warning together. Symptom number 5 is urine that becomes unusually dark and keeps returning to that color. Dehydration is the obvious explanation, and often the correct one. A person drinks more water, sees temporary improvement, and assumes the matter is finished. But when dark urine repeatedly returns despite normal fluid intake, especially alongside pale stool or yellow eyes, another explanation must be considered. The pancreas sits close to the common bile duct, a narrow passage that carries bile from the liver and gallbladder toward the intestine. A growth in the head of the pancreas can sometimes narrow or block that passage. Bilirubin, a yellow substance normally carried in bile, may then build up in the bloodstream and enter the urine. The color can shift from deep yellow to brown, tea-colored, or darker than usual. That description is not a diagnosis. Medicines, dehydration, liver disease, blood in the urine, and several other conditions can cause dark urine. The warning lies in persistence and combination. One isolated change may be harmless. A recurring change joined by appetite loss, weight loss, pain, or jaundice deserves prompt medical attention. Grace noticed the color one morning and blamed the hot weather. She drank extra water. It improved. Then it returned. She repeated the same explanation because it felt safer than asking why the pattern kept coming back. Fear often does that. It offers an easy story. The useful response is not panic. It is documentation. The person should note when the change began, whether hydration alters it, what medications are being taken, and whether the eyes or skin look different. A simple written record can turn a vague concern into a clear clinical history. Then another color disappeared. Symptom number 4 is stool that becomes unusually pale, gray, clay-colored, greasy, oily, or difficult to flush. It may float more often than usual and carry a stronger smell. This change can feel embarrassing to discuss, so many people remain silent. Yet, the bathroom can reveal whether bile and pancreatic enzymes are reaching the intestine as they should. Bile helps give stool its usual brown color. Pancreatic enzymes help break down fat. When bile flow is obstructed, stool may become pale. When too few digestive enzymes reach the intestine, fat may pass through without being fully absorbed. The medical term for fatty stool is steatorrhea. It can look oily, float, and leave a film in the toilet. There are other causes: gallbladder disease, liver problems, coeliac disease, chronic pancreatitis, infections, and certain medications can alter stool. That is why one change should not be used to diagnose cancer at home. But persistent pale or greasy stool, particularly when accompanied by weight loss or dark urine, deserves investigation. Grace had seen the change more than once. She changed what she ate. She avoided oil. She blamed one meal, then another. But the pattern continued even when the food changed. That was the clue. The problem was not following a particular dish. It was following her. The action is direct. The person should report the color, texture, frequency, duration, and any associated nausea or weight loss. There is no shame in describing what the body is doing. Silence protects the symptom, not the person. Now comes the sign that can be seen without a scale, a blood test, or a bathroom visit. Symptom number 3 is jaundice, yellowing of the whites of the eyes or the skin. In people with darker skin, the change may be easier to notice in the eyes, inside the mouth, or on the palms. Jaundice is not a normal part of aging. It means bilirubin is building up in the body, and the reason must be found. When a pancreatic growth blocks the bile duct, bilirubin may no longer flow normally into the intestine. It accumulates in the bloodstream, darkens the urine, lightens the stool, and may color the eyes or skin. It can also trigger intense itching without a visible rash because bile-related substances collect in the skin. Gallstones, hepatitis, medication reactions, and other liver or bile duct conditions are more common causes. That is important. Jaundice does not identify pancreatic cancer by itself. It does, however, require prompt medical evaluation because several possible causes need treatment. Grace's daughter noticed it first. Under daylight, the whites of Grace's eyes were no longer clear. Grace had also been scratching her arms at night, though no rash appeared. The dark urine, pale stool, itching, and yellow eyes were no longer separate mysteries. They were a connected pattern. This is the point where delay becomes dangerous. The person should not wait for a routine appointment weeks away when jaundice is new, worsening, or accompanied by abdominal pain, fever, vomiting, confusion, or marked weakness. A clinician may need blood tests and imaging to identify whether the blockage comes from gallstones, inflammation, a tumor, or another cause. Notice what has happened. The story began with tiredness and uncomfortable meals. Then came appetite loss, weight loss, pain, dark urine, altered stool, and yellow eyes. Each sign alone had several possible explanations. Together, they changed the level of concern. But the final two warnings break the pattern completely. One may begin in a swollen leg and threaten the lungs. The other may appear as an ordinary change in blood sugar. The first can demand emergency action. The second is the quietest reveal of all. Grace's family was finally seeing the complete message clearly. Symptom number 2 can appear far from the abdomen, an unexplained blood clot, often in a deep vein of one leg. The leg may become swollen, warm, tender, or painful. The change may affect only one side. It may be blamed on arthritis, poor circulation, or sitting too long, especially when no injury is remembered. Some cancers, including pancreatic cancer, can increase the blood's tendency to clot. This does not mean that every clot points to cancer. Surgery, immobility, pregnancy, certain medicines, inherited clotting conditions, and many other factors are more common explanations. The concern rises when a clot appears without a clear cause or occurs alongside other warning signs. The danger is not only in the leg. Part of a clot can travel to the lungs and cause a pulmonary embolism. Sudden shortness of breath, chest pain, faintness, or a rapid heartbeat requires emergency help immediately. This is not a symptom to watch overnight. It is not a problem to discuss at the next routine visit. It is an emergency. Grace never developed that crisis, but a neighbor of hers had once been treated for an unexplained clot and sent home without understanding that unexplained clots sometimes deserve a wider investigation. The lesson is not to demand a cancer diagnosis. It is to ask why the clot formed and whether the full medical picture has been reviewed. Then comes symptom number 1, the most counterintuitive warning in the countdown: new onset diabetes, or blood sugar, that suddenly becomes harder to control. The pancreas is not only involved in digestion, it also produces insulin, the hormone that helps regulate blood sugar. A disease affecting the pancreas can sometimes disturb that process. Research highlighted by the National Cancer Institute shows that about 1 in 100 people with new onset diabetes are diagnosed with pancreatic cancer within 3 years. That means most people with new diabetes do not have pancreatic cancer. Still, the connection matters. The same research also notes that roughly 1 in 4 people who develop pancreatic cancer had previously been diagnosed with diabetes. That figure must be handled carefully. Diabetes is common, pancreatic cancer is uncommon, and numbers without context can create needless fear. The useful question is whether the glucose change arrived with other unexplained changes. When it does, the clinician needs the complete story, not one laboratory result separated from everything the body has been showing for weeks, or perhaps several months. The pattern becomes more concerning when diabetes appears later in life alongside unexplained weight loss, appetite changes, upper abdominal or back pain, jaundice, or altered stool. It also deserves attention when blood sugar worsens unexpectedly, despite treatment, and no obvious change in diet, weight, or medication use. Grace's routine blood test provided the final clue. Her glucose had risen. Ordinarily, that result might have led to a conversation about diet and medication alone. But it did not stand alone. It sat beside weight loss, early fullness, dark urine, pale stool, and yellow eyes. That changed everything. A glucose result cannot diagnose pancreatic cancer. Neither can fatigue, pain, jaundice, or a clot by itself. The power lies in the pattern. When several changes gather, the safest response is a timely medical assessment that looks beyond each symptom in isolation. Grace's family finally wrote the timeline down. The date her appetite changed, the week her weight began falling, the meals that triggered discomfort, the mornings when her urine looked darker, the day her daughter noticed her eyes. The list was no longer vague. It was evidence of change. And the final step was not fear, it was action. The correct next step is to record every symptom, when it began, how often it appears, and whether it is worsening. The person should include weight changes, appetite changes, pain location, stool and urine changes, glucose readings, medications, and family history. Clear information leads to clearer decisions. A clinician may use an examination, blood tests, and imaging, such as CT, MRI, or endoscopic ultrasound, depending on the situation. No single symptom confirms pancreatic cancer, and no home remedy can rule it out. CA 19-9 may sometimes support an investigation, but it cannot reliably screen for or exclude the disease by itself. Prevention is not absolute. Some risks cannot be changed. Still, avoiding tobacco, maintaining a healthy weight, staying physically active, managing diabetes, and discussing chronic pancreatitis or strong family history with a doctor can reduce risk or support earlier surveillance. Meals should center on vegetables, beans, whole fruits, whole grains, and other nutrient-dense foods. Processed meats, sugary drinks, excess alcohol, and heavily processed foods should be limited. No tea, vitamin, herb, or cleanse has been proven to prevent pancreatic cancer. People with a strong family history or an inherited mutation may need specialist counseling and surveillance rather than routine population screening. Average risk adults without symptoms do not currently have one dependable screening test. That is why symptoms, personal risk, and family history must be considered together instead of being reduced to one reassuring result. Grace's strength did not come from pretending nothing was wrong. It came from noticing, recording, and speaking. That is the identity this message leaves behind. Not a frightened senior, but an informed person who refuses to surrender unexplained decline to the word aging. Independent, capable, alert, still fully present in the decisions that shape the years ahead. Viewers who found this useful should share it with someone who has been dismissing persistent changes. Then subscribe for the next senior health investigation. One shared video may help a family recognize a pattern before another month passes. The next video reveals why a normal CA 19-9 result can create false reassurance, the exact limitation most patients are never told, and how CT, MRI, and endoscopic ultrasound detect different details. One of those scans can see small pancreatic changes that another may miss. That difference could determine what gets found, what stays hidden, and what question must be asked at the next appointment. The next explanation should not be missed.